My name is Bobby from Wise Healthcare. Today, I'm here with Sali Shayia. Sally is a seasoned behavior therapist and a founder of Cramli Psychological and Behavioral Services. It's an NDIS registered provider specializing in specialist behavior support and therapeutic interventions across Victoria, Far North Queensland, Northern Territory, New South Wales, starting from Albury, Wodonga, and she's spreading the support for the people with disability and other healthcare needs across these states, starting from where they are active, working closely with a lot of different providers and allied health professional support coordinators, NDS participants, families on a lot of a variety of different fronts. Under her leadership, Cramli offers a diverse suite of services, including behavioral support, counseling, trauma-informed therapy, alternative models like animal-assisted therapy. Sally has a rabbit named Alfie. Yes?
Very cute rabbit with floppy ears.
And she's been recognized within the sector for her clinical excellence. Maintaining that balance between the work that we're doing, managing the team, working closely with the participants and the families, and then keeping up with the regulatory changes and everything. Going back to the day one, what drew you to start your own behavioral therapy practice, and how did Cramli come to be?
Sure. So my career started in the mental health. I predominantly worked in psychiatric hospitals. So my background started when I was 18 years old. And I worked in the eating disorder unit, and I also worked in AOD. So that was where my background, and with that came a lot of comorbidities. There was a lot of mental health, the complexities of it. And that really opened up my eyes about gaps in our sector from a very young age. And I really wanted to look into direct interventions, but how do we take that back into the home and the community, and how do you actually change that? So my background in behaviour support, Bobby, started when I used to work with those that use violence. This is a terminology now, but historically it was perpetrators of family violence. And my job was to work across two cities, so City of Casey and Cardinia Shire, to keep perpetrators home with their family and partners. So my job was to reduce the impact of their behaviours and actually psychoeducate them around, behaviour change model within the home. So I live and breathe behaviour. That's always been my work. And then I started my own family, and I realised that I couldn't get the flexibility at the time. This is all pre-COVID, right? Couldn't get the flexibility I needed to work in a career that I loved and then be home at the same time. I couldn't have it both. So I decided to start my own business where I can practice as a counsellor, which I am a qualified psychotherapist, a clinical psychotherapist. And I have, if you can see in that logo, that little husky there, well, he's a big boy. And I trained my dog to be a modality in my sessions around behaviour change, family violence, and counselling. And at the time I was registering under NDIS, it was something really, I'm going to give it a go. I'm only going to work for myself, only a couple of clients under counselling and so forth. But I was working for other providers, by the way. So I was working in behaviour support for many, many years. And then I registered for behaviour support, and then COVID hit. We were the fastest provider to register under behaviour support, as be a registered provider within 2 years. So we got our registration within 2 months. We had the amount of letters of support and recommendations. There were so many people advocating, not just for me, but for Cramli to be registered as a provider. And that was overwhelming. And that got sent to the commission, I believe, by many people, to the registrations department. And here we are today. Until this day, I am still trying to catch up. We boomed so quickly, Bobby. I went from just me to now we have over 30 staff.
Staff. That's expanding, spanning over 3 states, 3 or 4 states where you are.
3 states, correct. And look, we're not as big as other providers out there. I know providers that have over 100 staff, and that is phenomenal. But to us, this is meaningful, and to us, this is something that we can manage at the current moment.
I always believe that it's all the preliminary lessons that we've learned during our early stages, and especially in this sector where we are. The learning is endless. It is progressive, and with all the changes and keeping up. Give us an example or share an insight about one of the very initial cases when you started working with. So what drives you from those early stages?
So early stages, I believe that everyone saw the world the way I did. We're all about, mutual understanding, respect. Everyone operated the same way I did. Yeah, Bobby. I just thought everyone wanted peace, and that's all. I didn't think anything of it. And there was a beautiful young person that we worked with, a lot of challenges, but with that, the biggest barrier was their parents, unfortunately.
Mm.
And there was a lot of learning from that. And these particular parents it felt as though they didn't want their young person to succeed and be dependent or develop in a way that doesn't mum or dad. And through that, we went through a lot of challenges. We got reported to the commission and all of these fake allegations. We were very lucky, touch wood. We did fine. They did an investigation. Everything's good. You did great. We were fine. But the learning from that was I need to protect myself and my interests. I need to protect my company. That was the biggest learning because I didn't think that would happen. So I'm a big believer on defensible documentation. Everything we do, every conversation, every type of interaction is documented. And if it's not documented, it didn't happen.
Yep, that's exactly what I tell my people. If it's not documented, it never happened. It doesn't exist.
And it is always about how can we safeguard Cramli and its people? Because, and I think we've spoken about this before, no matter what you do, you're wrong. And no matter what you do, and even though you've done everything right, you're still wrong. And I think that was the biggest lesson for me is that I'm all about social justice. But no matter what I did, Bobby, I was always wrong. And even if I did everything right, I was still wrong. And I think that is what the lesson I learned is that now I need to defend my company. And I have a right to defend it because we work with over 300 people that we are responsible for. And if we shut, they're all affected.
Absolutely. Absolutely. And it's a lot of different ideas and thoughts that come from that brief insight where you've shared. But then,
absolutely. Talking about invoices, right, Bobby? I think that the biggest challenge I also found is that people don't have to pay, and there's no consequences.
Exactly.
And I can't go into a shop or access a service and go, I'm not going to pay today. I didn't agree to your report. I don't like it. Not last year, the year before that, we lost over $30,000 of unpaid invoices, and I had to write off. Last year was $23,000. I have to write off, and that's the thing is that doesn't actually look good for our books. No one's going to go, "Oh, this is a good company." Or look how many write. And that is another challenge that I realize that they don't have to pay, and that's okay.
Don't ask me the numbers, but consider a case scenario where a participant's health deteriorates. As a core service provider, we have to do a continuity of care, and with all the professionals in the care network, yes, there can be reports and everything that goes back to NDIS to backdate the outstanding from the previous plan because they needed extra support. And for the next plan or the plan renewal, they still don't give them that extended funding. So the amount is what you're telling me, 23,000 and 30,000. Don't ask me the amount that I've had to write off in the last financial year and this financial year. It's gonna hurt publicly. How do you balance those things, and how do you address those challenges when working with the participant and the family?
Look, I find my experience has been a lot of the barriers have always been, unfortunately, the parents or the families. I don't think they mean to be, or have opinions on how things should be or etc. But I do think that they are so tired, that they are so burnt out, that they have tried so hard to get the support that they need. That's, a lot of the time they probably have been let down, or it hasn't worked, or the people, or the clinicians didn't understand the family. And so they do have their own opinion and views of how things should run. And, it's a balancing act. I'm really big about being quite transparent and open about what we can and can't do. If you're honest about what it is that you can and can't do, I find that gets us better connection and relationship. And I'm a big believer of getting small wins. It could be as simple as, getting them to follow a token economy. It's proving that you're worth the investment and the time. And sometimes that is all about that relationship building, that rapport, and showing them what it is that you can do. But importantly, what is it that you can't do, but how can we still work together with everyone? It is about a team, and everyone plays a part. The reality is, if you've got families that are implementing a BSP, it's always going to start from top bottom. It is mum and dad that are going to implement it. We can't expect the young person to change when we need to model that behavior. We need to model what change looks like. And I'm honest to families, if you're not ready to do this, don't do it. You wait when you are ready, then we pick up when you're ready, because it is a long journey. It takes us a year to get to know someone. Within that year, we have to do 3 reports, Bobby, that are mandated.
Yeah.
80% of behaviour support is in back of house. We're writing reports. We unfortunately can't do a lot of face-to-face or do the implementation because we don't have the funds or the resources to do that. Let's say if someone is, for example, funded 20 hours, it takes us 45 hours to write the reports. We're already underfunded.
Yep. So we see that all the time.
Absolutely. And so I'm transparent. I try to, and I teach our team to be as honest as possible. The reality is, don't sign up to something you can't commit to. It's like a gym. Don't do it if you don't have the time to do it. Save your money. Invest the money in something else.
The family becomes a very important element, and it's not at the forefront. It's at the center of everything on changing a person's behavior and stuff. How do you navigate that through that mindset in the process of because of course it requires a lot of change in that individual mindset with those mums and dads. So how do you navigate that?
Provide an open space. I find that even now, and I'm very fortunate, I have good relationships with families. Even now when they've, let's say, no longer accessing services, I do sometimes receive phone calls and they just want to have a quick vent. I give them that space because no one gives them that space. I respect their journey, and I respect that they are where they are because of all of these challenges, and they are doing the best they can with the resources they have. Yeah, and that's what it is, Bobby, is I give them the respect that they probably don't have, and I try to give them an understanding that they can't fix it. You need to be present in that space. We can't fix people. We can't fix mum and dad. We can't fix the client. We can't fix them. It is their journey. We are along the way. We are part of that journey, but we're not forever. Our job is to work ourselves out of a job. And mum and dad's job is to get their child to a place where they don't have to be the full-time carers anymore. And that is scary because change is scary.
On that note, talking about mum and dad, now there are a lot of different scenarios, but going back to acknowledging that we do need to address the cause rather than just work towards the outcome from a person is. So we have to take a few steps back and understand where is this coming from. And that's the only way we can direct a participant through, or a family through, a particular fork in the journey. So how do you see with that limited funding as well, when you need a lot of funding to write those reports and everything, to put that everything together, and working with the core service provider to make sure that that mum and dad support is extended through, to the participant through the core service provider team and the support workers. So what works, what doesn't? How can we navigate that?
The way I look at it is, when you develop a plan, you have to write it for the audience that is going to be interpreting it. I come from a clinical background. I can sit and use all the fancy words and, and make it so complicated that no one can actually understand what I'm talking about, using simple language. And when you're explaining an approach or a strategy, break it down. If I was trying to teach a young person, let's say a 9-year-old, how would I explain to them how to do A, B, and C? It is about how we do it. And I'm a big believer of having the right team. Collaboration is what works, Bobby. You need to have the right SIL provider or the core supports provider. You need to have the right coordinator. And if they don't have a plan nominee or a legal representative, OPA, apply to the Department of Justice to get them a legal guardian.
And also making it in line with the previous reports as well, whether that's the last report you did, or the most recent report, or something that came from the psychologist, or that came from a OT or the support coordinator's opinion. But then making it in line in a very linear manner from even 3 years ago that you've been working with, addressing all the issues in a very progressive manner in every report that you do. It becomes paramount to make sure that that structure speaks for itself because anyone looking at that most recent behavioral report is looking at something that has a proper structured approach from a year ago or 2 years ago, 3 years ago, which is important for somebody to put that into practice.
Absolutely. But the thing is, if things change, the document has to change. It's a live document.
Absolutely.
But I agree. I look at my BSPs, or when we develop them, this is your one-stop shop for everything. Everything
Absolutely.
you need to know about that young person or that participant, no matter how old they are, that is what you need to go to. And our reports are so comprehensive. And Bobby, I'm not going to lie to you, it takes us sometimes 60 hours to write all these reports. But that is what is our job. Our job is we need to document all of this. If you look at all of the policy guidelines on the commission site, we have our own legislation and act that we have to follow. Behaviour support isn't all face-to-face. We do observations, but it is the back of house stuff that we have to do to give to you. And that is, I guess, what I want to, I guess, educate people about, is that as much as we want to do face-to-face, we don't have the luxury to do that.
When you go home with all the baggage that you carry from work and all those experiences throughout the day in the last 6 to 8 hours or 10 hours, 12 hours, what you spend on your chair, how do you leave that baggage out of the door and you drop it, and how do you shut it out?
You know what, Bobby, I'm really glad you mentioned that. I get asked that question all the time, and I have to learn to disconnect from that. I have mastered that for so many years, because the reality is, if I take all these things that are happening, take it home, it will affect my family.
Yeah.
And I think this is where COVID went wrong, if I can be quite honest. Working from home, there was no more boundaries. Work was home and home was work. Everything was muddled up. And this is where
everything intertwined with each other.
And this is why I'm against working from home, because home is your safe place. Work is where all the drama happens. You cannot link it together. The moment you link it together, I can't protect you or safeguard you.
True. Lightening up going on another thought, like building up reports, like what we talked about, making a linear report writing from what happened in the past, what we understood, what we experienced, and how the behavior has changed or deteriorated or improved, and what are the next steps that we need to do. How do you use AI?
We don't really use AI, no. We are still trying to work around how can we use AI as an add-on to assist us. I don't believe we are at that stage yet. And the reason why is a lot of our data, a lot of our work is data interpretation and trying to paint a picture and understand what's going on. AI is new, and I do believe in the future, AI will be used all the time. Even with our job, it's more sustainable to refer to AI or to incorporate AI in the business. 100% agree. It's more accurate. It will get us the outcomes we need, and we save hours, thousands of dollars and hours if we use AI. It will work. I know that, but I don't think we are ready yet.
A lot of people already got onto using AI for a lot of different fronts. I for a fact, a lot of people know I work with a lot of technologies, and I'm a technology enthusiast. I love making life easy.
I love it.
And I've just gotten into exploring different avenues with AI and everything. Yes, there are the gatekeeping and everything which we have to be mindful of ourselves and not go overboard. And there have to be those AI regulations that we have to be mindful of, even in practice, that we can't let AI take over, because the moment it starts hallucinating, it can take your business anywhere, and according to what it thinks is the right manner, which is not always the case scenario. But with AI, a lot of people are already using it to build reports, to put together those reports. I saw a software, somebody says, okay, I went to meet Shane and with such and such complex behaviors and this, write me the meeting report. And AI just spitted out a meeting report that doesn't even exist. So
And
without
just
any context, without any notes from that meeting, without any past records and everything. So
but
how do
that's
you
the
see
future.
these people who are using it?
Look, each company to their own. I know of many providers, not even providers, like other companies outside of NDIS are using AI. It's more sustainable for their business because they don't have
Yeah.
to pay, 4 or 5 staff to interpret data or analyze a psyche, a
Mm.
diagnostic assessment. It's doing it for them. I do believe in the future, things are going to change. Everything is going to be AI.
Yeah.
And I'm seeing that now. You've got, you put an expression of interest, or let's say you put through an intake, it automatically looks at the information and it allocates a practitioner that is a perfect fit. It's happening. It's inevitable. This is our world. Our world is changing, and it's either you move with it or you're going to be the one that's left behind.
With AI as well, I think it's going to be a learning curve and a transition of acceptance and remodeling the way people work, and it's going to change a lot. But I look at it is just with the advent of technology over the past with our experiences, it's going to be a bit of a transitional phase at the moment because it's at a very early stage. But in the long run, people are going to build up much better expertises and stuff with the AI on a lot of different fronts. They're going to get much more competitive. I think one of the things from what you are doing is not going to change even in 20 years is animal therapy. So tell me something about Alfie and this new dog that you're getting.
Sure. So historically we had that golden dog. So we had a Siberian Husky. He was in service for 16 years. So he worked in childcare centres, nursing homes, with me in family violence. He worked with me all the time, and he was the soul of Cramli, I guess you'd say. He had such an amazing impact, and he was able to work with many other clinicians, and he was so well trained, stubborn but well trained. So when he passed away about 2 years ago now, I was not ready in a position to get another dog because I was quite, 16 years with one dog. It's a long time. So our company did research, and rabbits are the 3rd most common used animals in therapy.
Right.
So our clinical services manager did a lot of research, and we found a clinic in South Australia that specifically breeds rabbits to work with behaviours or to work with people with challenges. And their temperament is quite, I guess you'd say, baseline. So they weed out the aggression in the rabbit, for example. And so this particular rabbit, we put our name down, we paid our deposit, and it was clinically bred for us, trained, and we have Alfie, our beautiful therapy bunny boy. You can see on our website. And he's loved by everyone. He's got an amazing personality. He's calm. He loves to be held, and he loves giving little kisses all the time. And he's a beautiful boy. And just the other day, I put our name down to get I love big dogs, as you can tell. We put our name down for a German Shepherd by breed line. So his father is a show dog and has amazing temperament and really wonderful with children and families and all people. We met the family, or we met the mum and dad, the dogs, and they are very beautiful. And we picked a wonderful little puppy named Storm, and he comes. We pick him up next week.
Right.
Then he'll be going through intensive training, and it'll take about a good couple of years to get him where he needs to be, so he can start working.
Right.
Yeah.
Very interesting.
Thank you.
Very, very interesting. And I think that is one thing that's not going to change in years to come. I think it's more of the way people are getting into the habit of those nuclear families living alone, families moving on, and families separating, and a lot of those cases and in the human relationships and everything. It's that another person's touch which animals fill a gap for, and they don't ask for anything in return, and it's a affection that they seek and affection that they give back. It's amazing.
The dog doesn't judge, and the dog will always provide you with unconditional love. You do no harm to it, and it will always respect you and come back to you, and it feels something that you probably don't even realize you have. I remember Kovu, when I'd be talking to someone and he would start howling. And then I remember this one guy goes to me, why is he doing that? He's sensing you're not well. And that man burst into tears. You know, it's those simple little things that you can use an animal as an alternative, as a modality in therapy that you can't bring. And it's safety, it's grounding, it's tangible, and it's safe.
Yeah, true. Give me an idea of a particular myth around behavioral therapy or a behavior support that you come across all the time.
Absolutely. We can fix everyone. Did you know that, Bobby? Apparently we can fix people's behaviors and make them be amazing. We can't fix
You never told me that.
No.
You never told me that.
We can't fix anyone. People choose to change. People only change if they choose to change. We can plant the seeds, look at the environment, we modify it, we train, we coach, and we model the change. But the person at the end of the day has to choose to change. You can't fix anyone because no one's broken.
But is that something that comes along pretty much in every different session with every case or client you work with?
We get that a lot. Oh, you know, there's a, you know, oh, we've got behavior support. They are stealing 3 cookies out of the cookie jar. We need you to stop that. No, I can't stop that. There's a reason why a person is, let's say, going in and trying to seek food. Are they not getting fed? Are they hungry? What is happening in their environment? And behavior is communication. My job is to understand why they are doing it and understand that what is it that they're communicating.
Yeah.
And we know, I come back to trauma real quickly. It's not about, you know, we need to be trauma informed and understanding what happened to this person. Go all the way back and go, why are they actually taking an extra 2 cookies out of the cookie jar? That is a silly example, Bobby. But, you know, I've had that before, by the way. Oh, you know, they're taking cookies. I want you to stop it. We can't stop it. Are you not feeding them enough? Are they actually craving something that they're not getting? This is our job. Our job is to find out the why.
How do you see what's the biggest system barriers in NDIS, whether that's the system or the regulations or the way of the collaborations when it comes to behavioral support and specific to restrictive practices? And with the awareness that's happening, where do you see the behavioral support in the NDIS sector to be in another 2 years or 5 years, for its sake?
Absolutely. Look, it's changing so rapidly, and the continuous changes in policy guidelines, expectations, and unfortunately, we don't, as much as we try so hard, we don't have the funds to provide the continuous, education and training. It is a very passive aggressive response. Is, you know, we'll send you an email. There's a new policy. Well, how do you put that into action when you don't have the resources to do so? The constant threats, our workforce is that we've got the highest turnover in our sector because we're constantly, you've got the regulator continuously threatening. Why would anyone stay? My biggest thing is we don't have support. As a business, as a registered business, I would love to see more support from the regulator, more development from the regulator to invest in registered providers that are trying so hard to do the right thing. That's what I'd love. I'd love us to see a community.
Do you think that is something? But do you think that is something that, yes, it can definitely be expected from the regulatory bodies, but is that something that's going to come in shape anytime soon that we see it's working? Or
not at all. I don't think it will change, and I think it's the response is still going to be quite punitive. It is still going to be quite threatening, and that is the approach that they need to take, which I understand because there is people's lives at risk, and I respect that. But I'm a big believer of how you do things, and you can send an email and get someone to join in an online course, but you're not allowed to talk in these courses. You're not allowed to actually ask questions. If you ask questions, you're scared that you're going to be scrutinized for it. And there is a lot of pressure on behavior support practitioners or a registered provider, like a specialist behavior support provider, to make such high risk decisions around chemical restraints and PRM. We are not medically trained, Bobby. We don't come from a medical background.
True.
So I do think that they've already been set up to fail. No matter what, we're always wrong.
Absolutely. That's an insight for a lot of different people to understand that we are designed to fail, but working together in collaboration, helping each other in the process with the other providers where we are regulated by the different regulatory bodies and people's insights who are not working with those participants on the ground on a one-to-one, to convey that message collectively over and over and over again, because one day the voice will be heard and there will be an action that will be taken, which will bring the change that we are always looking forward to, or we've always been wanting. Just going back years, like before NDIS, a lot of people wanted that to happen, or something like that to happen, but they did not have that structured recommendation or a suggestion. But somebody came up with an idea within NDIS, and look at where we are 10 years later. And it's a process that's going to be. Before I let you go, share with the audience or whoever's going to be listening on how can they get in contact with you to ask any further follow-up questions. Yes, we will have the comments open on those video and the online stuff. But if they want to get in contact with you directly at Cramli and or your team, besides the website at cramli.com.au and the phone number that you've got, admin@cramli.com.au, what are the other ways they can get hold of you?
Absolutely. So look, they can contact us by phone, of course. So we've got a 1-800 number, and you can you can always speak to someone from admin or management, and we're always happy to help out. You can contact us on LinkedIn. You can send us a message on Facebook. You can message us. We don't unfortunately have a social media team where they can continuously access our socials, but just please, my advice is send us an email or give us a phone. Just call us. We're much more responsive in that manner.
Perfect. Sali, thank you so much for your time, the depth of understanding and sharing the knowledge with the honesty that you brought to this conversation. It's not very often that we get to unpack a lot of these behavioral support experiences and myths, both from a clinical and human point of view. And I think to this chat, we covered pretty much exactly that information. You've given us a lot to think about, whether it's how we show up for participants beyond the paperwork, how trauma shapes behavior in ways we often overlook, or even what it means to lead a values-based organization like Cramli while growing across different states. To our listeners, if this discussion and this episode has made you reflect on anything, any other insights, with any of your experiences, something that gave you a new insight, or even you've thought of challenging something that you thought that you knew, we would love to hear from you. Please do share it, leave us a review, or just start a conversation and send us a message, send us a comment. I'm always reachable. My name's Bobby. I'm from Wise Healthcare. You can reach me out through online. You can call one of our Wise Healthcare numbers, and they can relay a message to me, and I can definitely get back to you. Thank you once again, Sali. And it's been a great conversation.
Thank you so much. Thank you, everyone.